السلام عليكم، يعطيكم العافية. اليوم محاضرتنا عن Toxicological Hazard of Solvents, Gases, Vapors and Other Chemicals. Solvents Toxicity mainly. إيش هم الsolvents؟ Solvents هم عبارة عن liquid organic chemicals. Okay, they dissolve easily organic solvents, variable lipophilicity and volatility, وmolecular size mainly small، ما عليهمش أي charge عشان يصير عندهم الابsorptions good بالgastrointestinal tract and cross the skin membranes. mainly the effects اللي هو central nervous systems. ممكن يتكون من different types of hydrocarbons, aliphatic, halogenated, في منهم aromatics also. أمثلة عليهم different examples: trichloroethylene, methylene chlorides, isopropanol and so on. Respiratory systems, because they are mainly also by inhalations, so the respiratory system mostly affected. First of all, we'll start with alcohols and glycols. Ethanol, mainly in dogs and cats. بصير عندنا ethanol intoxications correlated مع blood ethanol concentrations. clinical signs: attack, lethargy, sedations, hypothermia, maybe metabolic acidosis, okay, and others. Time and onset of clinical signs based, of course, the most important thing most of the time is the dose. Amount of food presented GI. This affects the absorption if they are through the GI tracts, and mainly the symptoms or onset of the disease within 1 hour of ingestion. The mode of action for ethanol: they make inhibitions for the GABA receptors. Then the chlorine ions increase at the postsynaptics, leading to their action at the central nervous system. The treatments: mainly clinical signs, based on clinical signs and severity of the clinical signs. Maybe we can use 4-methylpyrazoles, which is alcoholic dehydrogenase inhibitors, and maybe if we have some respiratory or something, we can use doxopram as a respiratory stimulants, and ventilations, and you can treat what happens based on the clinical signs. Methanol, almost same as ethanol. Inhalation or dermals بصير metabolizations بالADH للformaldehyde. الformaldehydes mainly أو بصير then by formic acids to اللي هو by formaldehyde dehydrogenase formic acids that lead to acidosis if more accumulation of the formic acids. Mechanisms: different methanols to formaldehyde, formaldehyde to formic acids, and then it's degraded to CO2 and H2O through these enzymes: alcoholic dehydrogenase, formaldehyde dehydrogenase, and the formal tetrahydrofolate synthase. Mechanism of toxicity: mainly it's interferon inhibitions of cytochrome oxidase at the eye and central nervous systems. This is why we have blindness, because of the affects the hearts, and also we have the neurological abnormalities because of affect the central nervous systems. That's the formic acids interference with the cytochrome oxidase and lead the formations of these clinical signs with destructions of these cells. Glycol toxicity اللي هو الإيثيلين glycol, mainly it's used as antifreeze, hydrofluids or others, mainly cause central nervous systems toxicity, and the accumulations leads to the metabolic acidosis. The treatment: mainly you can remove the source, so there is still the source, and try to decrease the exposure through the empty of the stomach, and based on the case also treat the clinical signs. Toxic gases and vapors. First we'll start with, we have difference: CO, carbon monoxide, hydrogen sulfide, oxide of nitrogen, ammonia, and smoke inhalation. Mainly the biotransformation of gases, mainly at the epithelial or the nasal cavity, olfactory and respiratory epithelial at the nasal cavity, and the lung, because mainly gases, the exposure through the or route of exposure, mainly the respiratory system, nasal cavity, and the lung. Carbon monoxide. Carbon monoxide is colorless, odorless, so they call it. So it's undetectable, so they call it the silent killers. Human as well as livestock and pets animals can be at the risk of exposures because of the intensive animal production units. They have heating to heat the products there or the waste. So hydrocarbon compensations can have effects and both acute lethal and sublethal. If the mode of action or the mechanisms of toxicity mainly cause the gases, the carbon monoxide cause hypoxia, and so it's considered as chemical asphyxiants. The reduced blood oxygen carrying capacity through the competition with oxygen, so the hemoglobin binds to CO instead of binding the oxygens. Most affected organs are heart and brain, and why is that? Because these have high metabolic rate and required oxygens with high quantity, so this is mainly affected because less oxygen supplied now. Venous blood also become saturation with carbon monoxide, cherry red appearance. Cardiac hemoglobin is also affected, and this leads to the myocardial depressions in cattle. The toxicity, acute high level of CO exposures maybe leads to unconsciousness or death because of asphyxia, non-pigmented mucous membranes, nails, and so on. All of these because of the list of oxygens, and the cherry red because of the presence of carbon monoxides with hemoglobin in the veins. Non-lethal exposures maybe leads to central nervous damage, seizures disorders, and dyspnea, maybe cardiac arrhythmia. The treatment, resuscitations, and combined with oxygen, so it's mainly removal from the exposure source to decrease the exposure of the animals or the livestock to the CO. In the same time, you can treat the clinical signs. Hydrogen sulfide gas, it's a byproduct also of decomposition of sulfur containing organic materials. Different source, manure tanks, septic tanks, and so on. H2S mainly absorbed through the lung. Metabolic detoxification to sulfate within erythrocytes and hepatocyte mitochondria. Mode of actions, produce cystatic anoxia. It's bind to ferric moiety of cytochrome C oxidase, so it's interfere with the cellular respiratory systems. So there is no energy, and so there is shifting to the anaerobic metabolism, leading to lactate accumulations and acidosis and death of the cell because of the less energy provided. Toxicity, apnea, sudden collapse, loss of consciousness, and death. Recovery from H2S if exposure ceases, so the treatment will, of course, managemental mainly, removal from the exposed. Permanent neurological damage, prolonged exposures or high to 250 ppm, acute respiratory stress due to pulmonary edema. Also, there may be irritations for the respiratory systems and for the ocular of the eye. Chronic exposures maybe leads to airway disease and chronic irritations for the airways. The treatments is the same as CO, resuscitations combined with oxygens and decrease the exposure. Oxides of nitrogens and O2, bleach-like odor, yellow stain on silage, so it can be identified. You see this in the silage. Source is silo, so they call it the silo filler disease. NO, any fresh silo or silo content comes in contact with oxygens in the air, so it forms the NO2, and also maybe contain monoxide, so it will be mixed toxicity there. In margin of exposure, as others, it's the NO2 also causes asphyxia, and beside the asphyxia, also it's caused methemoglobinemia. Methemoglobinemia is a form of it's that the hemoglobin, because of an O2, transforms to methemoglobin, and methemoglobin have low ability to carry oxygen to tissues. So this is what leads to tissue asphyxia and less oxygen to tissues, leading to decrease nerve supply to the tissue and cellular respirations, and may lead to irritation and corrosiveness. Free radical will be generated and forms leading to cellular death. Toxicity based on the concentration and duration of exposures. High level exposure may lead to sudden death because of asphyxia. Lower exposures maybe leads to weakness, respiratory distress, some edema, and if it's not treated will lead to more systematic problems. Bronchiolitis maybe prolongs for weeks or months following the initial exposure, even if it's treated, because it's somehow an irritant and interfere with the immune system. The treatment mainly methylene blue that can decrease the level of NO2 and other symptomatic treatments if needed. The gaseous ammonia, NH3, it's mainly in swine and poultry productions because of this, the can present in the feces. Yeah. The ammonia is lighter than air, and maybe it's to rise from the manure. So the most important thing in swine and poultry productions is the ventilation. The ventilation is very important to allow the ammonia to be out of the farm, and it's to keep it below 30 ppm. In mode of action, ammonia mainly it's irritant and corrosive based on the concentrations. It reacts with tissue waters and produce ammonium hydroxide, strong alkalines. So mainly this reaction is somehow produce temperatures, high temperatures, and produce heat, so it's tissue burns. And maybe they call it the condition alkali liquefaction necrosis, that it's caused by the tissue damage that caused by this alkali acid. The toxicity mainly involved in the upper respiratory tract. It's a gas and inhaled, the mucous membrane and the eye, and maybe you can see some burns of these tissues. Lower exposures, mainly lower eye and upper respiratory tract irritations, shallow breathing, excessive lacrimations, and other signs related to the respiratory systems. High exposure, you can see severe pulmonary disease and acute respiratory distress. The most important thing in the treatment is the improved ventilations and decrease the level of ammonia below 30 ppm. Smoke inhalation, it's a combination of exposure of different gases, may include different gases, may include carbon monoxide, may include cyanides, may include nitrite, ammonia, and so on. Different compounds can be in the smoke because the smoke is products from burn of different materials, and we don't know what's the fumes the content of the fumes, so it can be many. So the mode of action mainly depends on quantity in these fumes, but in general, because of the thermal damage of the heat, the smoke is somehow have high temperature, so the upper respiratory tract will have a thermal damage. Pulmonary irritation, systemic effect maybe if it depends on the monoxides or nitrous oxide, may lead to chemical asphyxiations. If it has also an O2 or NO3, may lead to methemoglobinemia and inability to carry oxygens and leads to cellular damage. Clinical signs mainly change in the voice and maybe carbonaceous nasal discharge, coughing, all related to respiratory systems, and maybe some to the heart because the effects on the respiratory have effect on the heart, like tachypnea and so on. The treatment, we can use some bronchodilations, some suppression for the inflammations, and prevent maybe use secondary infections if we have serious inflammations. In case of cyanide poisoning, we'll have hydroxycobalamin with thiosulfate. If we have a metal fumes, we can use corticosteroids. organic compounds such as persistent subgenated aromatic compounds such as polycarbonated biphenyls, polycarbonate biphenyls. All of these is persistence pollutants that is persist in the environment, and it can enter the animals through dust, for example, or through contaminated feed. We also maybe through the concentrates that's added to the feed or food, because it's bioaccumulated abagnified in fish or through the marine environments, so it can enter the feeds of the animals and cause toxicity. It's biomagnified mainly in fat and liver because it's and can secreted in milk and egg. Mode of action mainly it's immunotoxic. Its interaction with immunotoxic nuclear receptors, interact with nuclear receptors, and promoters of carcinogens. So it's really toxic. Toxicity mainly based on the different things, methods and age of exposure, sex of individuals, dose and duration. Sex of individuals mainly because they are endocrine receptors, so they mainly affect females more than males somehow. Absorbed from the gut, lung, and through skin, maybe cause acute and chronic, but maybe because it's somehow bioaccumulated and can the animals take it from time to time. The chronic effects mainly is more disruption of the immune and endocrine systems, and mainly in cats, acromegaly in cats, and it's caused acromegaly in cats because it's the cat more sensitive than others because it's less metabolized in cats comparing to others. In chicken, you can find sudden drop in egg production and reduced egg hatchability. Collar tar product poisoning, it's mainly from kerosol, phenol compounds. Phenol is the most important toxin in coal tar. Maybe it's found in antiseptics, germicides, cleaners, and disinfectants. Its toxicity may be absorbed orally or through the skin, and it's caused mainly if it's through the skin or contact with the skin, maybe cause scarring with the skin, through the mouth and the GI, maybe cause also necrosis in the mouth and esophagus, weakness, and maybe central nervous system stimulation like tremors, coordination, and also cardiovascular system may be involved. Secondary anemia maybe develops if you have other problems. Capillary damage and hepatic or renal damage also involves because of these phenols. Because of the liver damage and renal damage, icterus may be there. Cats are more susceptible due to the limited ability to form glucuronides of these compounds. The treatment: active charcoal and egg white help to dilute and bind the phenols. If it's dermal contact, bathing glycerol followed by liquid dish soap. Supportive therapy and for recovery, can give oral antibiotics, B vitamins, vitamin A, and high quality protein diets. Household hazards like chlorine bleaching, detergents, soaps, and shampoos. Mainly chlorine bleach contain mainly sodium hypochlorates. Sodium hypochlorates, the bleach, the hazards depends on different things: the concentration, the pH, and dilution of the products. The pH, if it's more than 11 or less than 3.5, it's a corrosive effects. The home bleach mainly it's between that, it's more than 3.5 and less than 10. If it's less than 10% concentration, okay, vomiting, hypersalivation, depression, anorexia may be formed. If it's more than 10%, so the pH will be more than 11, so severe GI corrosive injury will happen because of the high alkalinity of these compounds. High quantity may be hypernatremia, hyperchloremia, and maybe metabolic acidosis. Acute inhalation may lead to respiratory signs and lesions in if it's high exposure. Respiratory signs maybe if it's the concentration is high, maybe burns of the nasal mucous membranes, and also may lead to irritations and edema. The treatments depend on the exposure route. If it's oral, dilution with milk or water. Don't do an emetic because it's corrosive, so it will make corrosions for the upper GI tract. If it's derming, bathing with shampoo, mild shampoo, and through rinsing, ocular exposures also treated with physiological saline. Detergent, soap, and shampoo. Mild detergent, soap, and shampoo contain anionic and non-ionic detergents. Mild irritants to eye, mouth, and GI. Cat grooming with sodium lauryl sulfates maybe leads to somehow respiratory distress, cyanosis, and dyspnea. All of that's because this cyanosis and dyspnea because of lack of oxygen. The treatment you can make dilution with milk or water. Antiemetic, mainly metoclobramides, 0.2 to 0.4 milligram per kilogram. If there is any ocular exposure and the eye are involved, you should irrigate the eye and washes and dilutes the toxicant. Thank you very much.